Good night. I am Jesse Williams. Welcome back to Mary Cole News. Recently, there has been an increase in motor vehicle accidents. This means the chances of spinal cord injuries or SCIs occurring has also increased. These life-altering injuries don't just paralyze the body, they challenge the spirit. Tonight, we go behind the scenes at St. Catherine's Hospital to understand the science and the care behind spinal cord injuries.
Patient verbalized fear, stating, "I'm scared, I'll never walk again," and appeared tearful, anxious, and emotionally distressed. Reports inability to move or feel legs. Denies pain, airway patent, speaking clearly in full sentences. Respiratory rate 22 breaths per minute, slightly shallow, symmetrically chest rise. Oxygen saturation 97% on room air. No accessory muscle use or adventitious sound noted. Cardiovascular blood pressure 92/60 millimeters of mercury. Heart rate 56 beats per minute. Consistent with neurogenic shock. Capillary fill less than 3 seconds. Skin cool below the level of lesion.
Pulse palpable in upper limbs, weak in lower limbs, neurological, alert and oriented ×3, GCS 15, motor, upper limbs 5/5, bilaterally score. Grade A, integumentary, skin, warm above T8, cool and pale below. Stage 1 pressure injury to sacrum with non-blanchable arrhythmia.
Moisture noted due to incontinence, Braden score 11, high waist, GI, abdomen soft, mildly distended, hypoactive bowel sounds in all quadrants, no bowel movement since injury. GU, Foley catheter inserted on arrival, draining 750 milliliters clear amber urine. Patient reports no sensation of bladder fullness. Risk for urinary retention and UTI due to neurogenic bladder.
Musculoskeletal, full range of motion upper limbs, passive range of motion to lower limbs only. Flaccid tone requires full assistance for positioning. Psychosocial, expressing fear, helplessness with limited support system. Requests emotional counseling. Learning needs. Unfamiliar with spinal cord injury care. Requested information on recovery and self-care. Functional, dependent for all ADLs, including repositioning and using long roll techniques with two person assisting. Sacral skin protection with barrier cream, Foley catheter care maintained, engage in supportive communication provided by introductory education on injury, skin care and bladder bowel management, referral to physiotherapy, occupational therapy and mental health service initiated. Patient verbalize appreciation for support and education, continues to exhibit anxiety but responsive to care and engagement efforts.
Okay, so the patient's name is Miss Brown. She was in a motor vehicle accident. Alright. Her blood pressure is 92/60. Her heart rate is 56 beats per minute. Her SpO2 97. Her temperature is 36.5 Celsius.
Oh my God. I can't feel nothing. I can't move.
So what would you rate your pain from 0 to 10?
I can't feel nothing. 0.
Mrs. Brown, I know you say you feel a little anxious right now, but I'm going to see to explain your injury to you. Okay, so you have what we call a spinal cord injury. It refers to damage to the spinal cord that results in partial or complete disruption of neural transmission below the level of the injury. It may be classified as traumatic, commonly due to motor vehicle accidents like you had, or non-traumatic like falls and stuff like that.
It just happened so fast, doctor. It's like the vehicle just come, lick up in me and me just fly through the windscreen and the doctor, it's like a miracle me alive.
Okay.
It's a miracle, but oh me I go look after me pitney them.
Okay, let me just. Okay, in your case, Mrs. Wong, your trauma was due to a high velocity crash.
They me fly through the windscreen.
Yes. And it was your TA. So you have a fracture, vertebral fracture, that resulted in spinal compression.
So that time we can't go walk again.
Well, we'll have to run some tests. Injury, which involves mechanical disruption of axons, neurons, and supporting vasculature, and then it could later be followed by a secondary cascade, which includes ischemia, excitotoxicity, inflammation, and apoptosis. Okay, but in your case, you just have a primary injury.
Okay, doctor.
Brown exhibited the hallmark signs of a thoracic spinal cord injury, which includes flaccid paralysis, paralysis of your lower extremities.
You can't feel nothing.
Understand that.
Can't move.
You had no deep tendon reflexes, and as you said, you haven't peeled
You can't feel like me feel
since
pressure.
you
Me
since
can't
the accident.
No,
You're also hypotensive. We initiated a trauma protocol with immediate spinal immobilization, and we will be doing some testing, which will include a CT scan to identify fractures and an awaited T2 MRI to evaluate the spinal cord edema and hemorrhage. These are the gold standard tests for spinal cord evaluation. Okay?
Okay, doctor.
Your AIS classification was A, which means is complete injury with no motor or sensory function preserved below the point where you were injured.
Okay, doctor.
Yes. Some nurses are going to come and they're going to take you for your MRI and your CT scan. Okay.
And they're going to provide care for me, doctor?
Yes, they will. They will explain more to you.
Okay, so what nursing diagnosis do you guys think that we can implement for this patient?
Well, I'm thinking about impaired physical mobility related to neuromuscular impairment secondary to TA spinal cord injury as evidenced by flaccid paralysis of lower limbs, ASI grade A, and dependency in ADLs.
Effective coping related to sudden loss of function, altered body image, limited support system as evidenced by tearfulness, verbalization of fear, I'm scared I'll never walk again, and anxiety.
And also we can have risk for impaired skin integrity as evidenced by decreased mobility, incontinence, and altered sensation below the level of injury.
Ms. Brown was placed on a 2-hour turn-in schedule to prevent pressure ulcers. A Foley catheter was maintained initially, followed by a bladder training program using intermittent catheterization to reduce UTI risk. Bowel training was also implemented.
We implemented deep vein thrombosis prophylaxis using compression stockings and cleansing. Psychosocial support was also essential as patients with spinal cord injury are at elevated risk for depression and anxiety.
Also, education and involvement of family members began during the acute phase to ensure continuity of care into rehabilitation.
Right.
Nurse in charge, the Clexane and catheterization were prescribed by a doctor.
Good day, Miss Brown.
Good day.
How are you feeling?
I still feel, worried that I can't move, and I have my children and they don't have no father.
Okay.
I get pregnant at the age of 16 and ever since then, I keep having children. I don't have no baby father.
Your surgery was successful. Yes. While you're in the hospital, you'll be visited by your physiotherapist just to help with your rehabilitation.
Okay.
We have, upon discharge, you will be assigned to a social worker, and the nurses from the health center near your home, they will come to visit you.
Yes.
You will also be assigned a caregiver. So we are going to give you some tips to basically help you.
So about my financial situation.
Oh Lord, your financial situation. Well, Miss Brown, we have payment plans at the hospital, so you will be able to, pay as you go. Also, as I said, you'll be visited by the nurses from the health center just to help with your rehabilitation. Some tips that we will give to you is to have your caregiver assess your skin on a daily basis, because remember you're not moving, so you're at risk for ulcers.
Yes.
Okay.
So talk to the social worker for me about putting me on the social for the lift money, the 500.
We have assigned a social worker, so she will come along to discuss all of that with you.
Okay. Thank you, doctor.
Okay, no problem.
And the nurses, they were very caring and they make sure that I was feeling good, even though I can't move. I'm grateful. They were my hands. I'm grateful for them.
Okay, Miss Brown, just get some rest.
Thank you.
Okay.
Good night, people of St. Catherine. We are the nurses from the St. Catherine Hospital, right? And we are here to discuss what is happening is that we have a high rate of car accidents, and we know that civilians and citizens, they are concerned. So tonight, my team members and I are here to discuss. So, nurse, can you tell them your name?
Nurse Max, student nurse Max.
We'll discuss the objectives for this evening's 20 minutes presentation.
We'll define what is spinal cord injury. We will explain the basic pathophysiology. We will list some common causes and risk factors. We will identify the key clinical signs and symptoms, describe the relevant diagnostic tests, and summarize the medical treatment options. We will also outline essential nursing intervention and recognize potential complications. And last, we will provide basic health education and promotion skills.
From crisis to recovery, spinal cord injuries require a team and a community. If you or someone you love is living with SCI, know that knowledge, care, and compassion can make all the difference. Remember to wear your seatbelts, do not speed, and don't drive under the influence of drugs and alcohol. I'm Jessie Williams, and this has been Mexico News. Have an amazing night. Today I am Carrie Renix. I am a student nurse. I played Jessie Williams, the news reporter, and Dr. Williams.
Good day, my name is student nurse Hodge Patrick, and I played one of the nurses in this play.
My name is Charlene Max. I'm a student nurse and I played a nurse in the skit.
It's Alina Allen, and I'm a student nurse, and I played a nurse in the skit.
My name is student nurse Shani Campbell Isaac, and I played the patient, Miss Brown. Help me look after me, pick the name.